Hi, everybody. My name is Morgan Davidson, and I'm the Director of Marketing and Communications for the Canadian Liver Foundation. Welcome back to another edition of our Meet the Researcher series. You'll notice that I'm in a different setting because I'm actually in the office for the first time for one of these, slowly making our way back to the office, back to normal times. As we've shared in previous videos, our goal with this series really is to introduce you, our community, and help you all really get to know the people who are truly bringing research to life. So these are the professionals that are doing the work to advance prevention, diagnosis, treatment, and even in some cases find cures for liver disease across Canada. I'm thrilled today to be joined by Dr. Naglaa Shoukry. She's a professor of medicine at the University of Montreal and University of Montreal Hospital Research Centre. And she is also the director of the Canadian Network on Hepatitis C, which we also commonly refer to as CanHep C. And it's July, World Hepatitis Day is happening July 28th. So we thought, what a great time to connect and really dive into the work that she's doing and also talk a little bit about what CanHep C does and what they're all about. Before we get started on the questions, I'll share a little bit more about Dr. Shoukry. She obtained her pharmacy degree from Cairo University and her PhD in immunology from McGill University. And throughout her career, she's focused on hepatitis, liver fibrosis, and liver cancer in her work. The Canadian Institutes of Health Research profiled her achievements on World Hepatitis Day in 2013 and 2017. And in 2019, she was selected as Professor of the Year by the Department of Medicine at the University of Montreal. And in that year, she was also awarded the Canadian Liver Foundation 50th Anniversary Recognition Medal. We at the CLF have been so proud to work with Dr. Shoukry and CanHep C. And I'm so glad that we're connecting today to get to know you a little bit better and introduce you to our community. So thank you so much for joining us.
Thank you for this invitation. It's always a pleasure to do something for the CLF.
That's great.
You do a lot, so.
Yes, yeah, no, well, and as do you. We covered the bio highlights, but maybe in your own words, why don't we just start with you introducing yourself and your role, particularly with CanHep C, and what you really do at a high level.
Okay, so I'm trained as a pharmacist turned immunologist. So I study immunity to hepatitis C, and the goal of my own research really is to understand how the immune system interacts with the virus and use that information to develop a vaccine, which is something that we still do not have for hepatitis C. Another part of my work, like you mentioned, is also studying the immune response that happens in the context of liver disease due to different origins, whether it is hepatitis C, hepatitis B, fatty liver disease, and also how the immune system could be harnessed in order to treat or prevent the happening of liver cancer. So that's my own research. I'm a basic scientist, so I don't see patients. I work in a lab. I work with cells, with mice, with blood from patients, but I'm not a clinician myself. Then there is CanHep C, which is, as you mentioned, is the Canadian Network for Hepatitis C. So CanHep C actually is a pan-Canadian network. We have been around for quite a long time, but it was previously known as the National Hepatitis C Training Program. It was started by Dr. Jenny Heathcote, who is one of the legends of hepatology in Canada and the world. But it was just a training program, training researchers who work on hepatitis C. It was renewed once. The director was Dr. Marc Bilodeau, was also one of the leading hepatologists in Canada, was the president of CASL during the last term. And in 2015, I took over, and the network transferred from just a training program into a research network. So we have almost 100 members from all across Canada. They are researchers who are working on different aspects of hepatitis C. So there are basic investigators like myself, people who work in a lab, who just try to look at things like how to develop a vaccine or new treatments or how the virus replicates in liver cells. Then there are clinicians who work with patients and who look at like the clinical aspects of the disease, liver, how does this affect the overall health, treatments, etc. And we have epidemiologists who look at the overall problem of hepatitis C in Canada, what are the numbers, what populations are affected the most, and then we have population health. And those are individuals that are more into public health aspects of things and policies that could change what hepatitis C looks like in Canada and towards eliminating it. We also have, as we continue, the training component. So we train the next generation of researchers in all these areas of research. So it's not just focused on one, but all these areas of research. So we have graduate students. We also take on summer students, so students that are still in their bachelor's, but we fund them to do like summer internships with researchers from the network that we call them mentors. Another important component of CanHep C is knowledge translation, interaction with the community. And in that aspect, we collaborate with organizations like the Canadian Liver Foundation, KT, community organizations that deal with patients, and also organizations that deal with specific populations, what we call priority populations that are affected by hepatitis C, like people who use drugs or indigenous populations. And I am the director of the network, so I oversee all of this. So although my own research expertise are only a small part, which is the basic research, I oversee all of this and I make sure that we all interact, and really the goal of the network is to create this pipeline to reach hepatitis C elimination in Canada. And we are funded by the Canadian Institutes of Health Research and the Public Health Agency of Canada.
Yes, it's such a broad spectrum you guys cover. But it's incredible that it is so diverse and there's so much work being done that's really dedicated to hepatitis. I guess my next question, it could be specific to CanHep C, but could even just be at a broader level. Is there any research or progress or projects underway with CanHep C right now, or in the work that you do day to day, that is being made in the study of liver disease that you are really excited about? Like, is there anything really interesting or exciting that you're seeing in the work that you're doing that is sort of in the spirit of either eliminating hepatitis or other types of liver disease?
Well, there's a lot of interesting work happening, facilitated by CanHep C, and a lot of work that is being done by the CanHep C trainees and CanHep C investigators. I would say our main aim at present is, of course, hepatitis C elimination. And 2 years ago, we developed the blueprint for hepatitis C elimination in Canada. And this is available on our website. And I'm pretty sure you can find it if you just Google blueprint for hepatitis C elimination in Canada. And what this is, basically, we all got together, all the different experts in CanHep C, and we wanted to provide guidelines on what needs to be done to achieve hepatitis C elimination in Canada and provide a menu of choices for different jurisdictions that they can basically adapt this to their specific needs. So I think that was one of the major accomplishments of CanHep C. And what we are working on right now in the Canadian Liver Foundation is a big partner is that we are trying to organize what we call regional meetings, basically to meet with people in different settings, different parts of Canada, to see, like, based on their situation, because we are not all the same. Canada is a big country, how they can adapt that blueprint to their practice. So this is something that I'm very excited about, that CanHep C is doing. The effort is led by Dr. Jordan Feld, who I know you are also interviewing. So I think from an overall pan-Canadian perspective, this is really like one of the major things with CanHep C. On the other hand, from a discovery perspective, from a research perspective, like I mentioned, our researchers are doing exciting work. One of our researchers is Dr. Michael Houghton, who is the one of the Nobel laureates 2020 for his discovery of hepatitis C. And together with Dr. Lauren Tyrell at the Li Ka-shing Institute at the University of Alberta, they are working on the development of hepatitis C vaccines, which I think is the other part of elimination. Because, as we've all learned from COVID, you can have treatments that can be very effective in the context of hepatitis C, not so much for COVID, but vaccines are really, if you really want to eliminate the spread of a viral infection, you absolutely need a vaccine. So that's another research that I'm very excited about. I don't know if I can say other things, but those are the two main things. I would say also a lot of the work that we have established over the past 5 years since CanHep C was created in 2015, I guess it's almost 6 now, is that we've built bridges with different communities, in particular with the Indigenous populations. And we are working with them to try and understand the hepatitis C epidemic in that population, and to develop what we call cascade of care, or that would facilitate their engagement into healthcare, to be tested for hepatitis C, to receive treatment in ways that are culturally appropriate and suitable for where they live, depending on their setting. So.
That's a lot to be very excited about. I'll definitely will make sure to link the blueprint, because I've taken a look at that. It's a very comprehensive and fascinating document to go through. And I think for anybody who's interested in this, they would also find it very interesting. And also just the thought of, vaccines in our lifetime or even in the next lifetime for it to be
it's not a far stretch, when you think about COVID and vaccines, and I really just want to stress this point, because a lot of people, especially at the policy level, would say that now we have excellent treatments for hepatitis C. Why do we need a vaccine? You need a vaccine for all these people who do not have access to treatment, that do not even know that they are infected. And we were able to get a COVID vaccine into jabs into arms in a record time, because a lot of money and a lot of political will was behind that. And if I would say 25% or even less than that was there for hepatitis C, we would be a great success.
For sure. Yeah, I know that that's been an important piece to highlight in sort of the greater conversation in the vaccine discussion, is just when the funding is there, even that can just accelerate.
Not just the funding, the political will.
Yes, absolutely. There's so many moving pieces for sure. But it's incredible to know that the science is advancing in that way, and to be, again, I know that's why we're, so proud at the CLF to be able to partner with organizations like CanHep C and researchers like yourself, because it really is, and I think we covered this in the last video as well, and part of the reason why we're doing this is because it can feel very abstract sometimes. Okay, if I make a donation and you say that's funding research, what does that really mean? And so it's so important to highlight, no, it's there's some really amazing, exciting strides being made, and it could really mean that the scale of something like hepatitis just isn't as far and wide as it is, today. So it's very promising and exciting to know that that's the kind of work that's happening in these areas.
Mhm.
I guess like on a more personal note, you've obviously been doing this work for, this has been you've dedicated your career to a lot of this. What do you love the most about your job?
I guess it's the satisfaction when you I think especially with trainees, when you get them, like, they don't know much about research, they don't know much about science. And some are made for this, some are not. But if you have good ones that you see that are improving every day, every year, I always say that, there's a point, I would say around the second year of a trainee within the lab, that they just take off. It clicks and they just take off. And it's really very gratifying when they finish and you see that, you've made a difference in somebody's life. And you also know that at the end, what they are doing and what you are doing is benefiting patients in a way. So sometimes it may not be so obvious, like I would say maybe with clinical research, because they work directly with patients and treatments and all of this. Sometimes it's right away, but with basic science, it takes a little bit longer. But, again, when you think about Dr. Michael Houghton, his discovery of the hepatitis C, he's somebody who got to see, a disease being cured in his lifetime. I think it's amazing. Just that potential is amazing.
Absolutely, must be so rewarding. And I guess, yeah, when you're not at work, I always love to ask this question because I imagine that the work that researchers like yourself do, or people, clinicians, anybody who works in this space, I can imagine it's an intense job when you're in it. So I always love to ask, how do you, outside of work, like to kind of step away and relax and take a break?
I cook. Yeah, I love to cook. I think I'm a good cook. At least people say I'm a good cook.
And I feel like the last year too has been probably really nice to have more time.
It has been very intense. So last year I would say have been a lot of cooking and gardening. Yeah, I love to cook. I also love to just, be able to go to a market, like, an outdoors market, and, see the fresh vegetables, fresh fruits, be able to benefit from that. That would be, what I do when I'm at home. But also I love to travel when we can.
Yeah,
it's something that I've been missing really this past year and a half. I'm not used to not traveling for so long. But yeah, I love to travel, and I always try to make a point that if I'm going to a conference, to a place where I haven't been before, to take a few extra days and just visit and get to know the locals. So yeah, I would say travel and cooking.
Those are two very wonderful hobbies. I also miss travel. I mean, I know things are slowly starting to reopen, but I am looking forward to the first chance I can get to get on an airplane and go somewhere, change the scenery.
Yes.
And I guess to close it out, if you weren't doing this work, what do you think you would be doing in a different?
I'd open a restaurant.
That's amazing. What kind of cooking do you like to do?
Well, I'm originally from Egypt, so I cook what I know, what I learned from grandmother. So it's mostly Egyptian, Middle Eastern cooking. Delicious. So yeah, but yeah, I mean, I cook different things, but you know, I'm always hesitant to cook, for instance, like, I don't know, Italian or
Yeah,
Chinese, or, you know, especially for people who come from that background.
for sure. Yeah, but that must be, you know, I think that's the comforting, relaxing aspect. Is if
Yeah.
it's a comfort. You know, you're cooking what you know and what you love, and honestly, that sounds phenomenal. I love Egyptian food. So, if you had a restaurant, I would absolutely visit it.
Well, if you are ever in Montreal, you are more than welcome to come to my
Fantastic.
home.
Good to know. Oh, that's great. Well, that's all I had for questions. It's been really great to even just for me to get a deeper understanding of CanHep C. I joined the CLF last year, so every time I get a chance to talk to researchers and clinicians and anybody sort of working on doing the actual work on the ground, I'm always just blown away by the dedication everybody has, and I feel like I feel the same here, and I can tell that you're very committed to this work, and I know that means a lot for me, but it means even more to our community to be able to see just how invested the people sort of on the front lines are in the work to, you know, make progress in this space. So thank you so much for everything you do. Thank you for your time today. I really appreciate it.
Well, thank you very much. It was a great pleasure, and thank you to the CLF for all the great work they do. And I know this is to reach donors, so your money makes a difference. I personally received research funding from the CLF a couple of times, and that was actually instrumental, especially early in my career, because it allowed me to generate what we call the preliminary data, like the early results that say that this can work. And it allowed me to go on and get funding from big funding agencies like the Canadian Institutes for Health Research. Also, I've had trainees that were funded by the CLF, and they went on to do great things. So really, your money makes a difference. So donate to the CLF for research.
Thank you. Thank you for that endorsement. That's, yeah, means a lot. All right. Well, I hope you have a wonderful rest of your day, and
You too.
hope the life is treating you well in Montreal.